Right. Cookies first and now cloud. What next? Okay, so in the IT jargon, I'm not an expert, but I'm a physician. I lived abroad for approximately 25 years. I qualified 25 years ago. My contact with IT came nearly in early 90s, late 80s, when I was working in North Middlesex Hospital. I trained as a chest physician. I have been in touch with IT since then on a regular basis, off and on. So I'm Dr. Pradeep Mishra, ladies and gentlemen. Let me tell you, I think it is now good midday, not good morning. I think I was supposed to speak in the first session. And I'm really privileged that eHealth gave me this platform to say what I have got to say. My topic basically is about e-transformation of primary healthcare, a vision for modern India. I won't talk about my own website much. It is called www.ilajonline.com. You can look at it and you can say and give me a feedback. I've got my email on that. Having worked at both ends of the spectrum, a failing public healthcare system in India, and probably the best and most successful healthcare system abroad, I have now felt passionately about rural healthcare and primary healthcare, and that is what I'm going to talk about. So let us start on a positive note by saying that the decision of the government recently that came in the newspaper was they are going to increase the health expenditure from 1.4% to 2.5%. However, it remains to be seen how much of it goes really to the people who need it most at the grassroots level. And we have stories from Uttar Pradesh, we all know about that. Free access to good quality healthcare is one of the pillars of an egalitarian society. Sadly, India fails miserably on this account. Historically speaking, India never considered health and nutrition of its people to be tackled seriously and persistently. We did have, at least on paper, excellent plans, one of which is worthy of reconsideration even today. The Board Committee report presented as early as 1946 is one such plan made in India much before a declaration was made in Alma-Ata, about which Dr. Annie Thakur mentioned a few moments earlier. This declaration was famously known as Alma-Ata Declaration of 1978. It was organized by and presented by World Health Organization. India as a member state was a signatory to this momentous declaration. So what happened? That primary health care got neglected in a country where it was needed most. Time does not permit us to go into a detailed analysis of the various factors that weaken the public healthcare system in India, but a combination of both international pressure and national apathy may be the reasons behind it. So what was the Alma-Ata Declaration? I'm not going to read it because of the pressure of the time, but it's quite evident. It is a very lofty ideal. It says the conference strongly reaffirms that health, which is a state of complete physical and mental and social well-being, and not merely an absence of disease and infirmity, is a fundamental human right, and attainment of highest possible level of health is the most important worldwide social goal, whose realization requires the action of many other social and economic sectors in addition to the health sector. So you see, it is a lofty ideal, and the lofty ideals need concrete steps. A robust primary healthcare system is an effective tool which we need at our disposal to make India a strong country, literally speaking. The information technology with reliable infrastructure at the primary healthcare level can lead this movement from the front and support it from the back as well, So let us infuse this modern electronic energy in proper and thoughtful doses in the primary healthcare sector to resurrect and reorganize this most important format of healthcare delivery in India and gradually improve the indicators such as infant mortality, maternal mortality, and many other parameters of healthcare. So you see, people are here at the interface of business, IT, and health sector, and I'm sure I'm the odd man out. I'm advocating for the rural health care, and I'm sure that business people can move into rural health care and provide a backup in public and private partnership. Now I'll take you to the next slide, and there are the hurdles. You can read it. Poor education, especially in health and hygiene, diverse culture and practices of health care, substandard and inequitable public health infrastructure, lack of will at the political level to improve, top-down or vertical approach in delivery. What are the basic principles on which I suggest the e-health software should be created? You can read it again. Women and children always considered first and actively targeted. Clinical epidemiological data collected quarterly and audited with the help of experts. Each person in a defined population must be a stakeholder in proper functioning of primary health care. Emphasis on prevention and health education. Public-private partnership encouraged. No top-down approach, guidelines developed locally. And what are the fundamentals? Well, you must have trained personnel both in health and IT, regular visits by an IT support service to check the system, computer, printer, fax and scanner, regular uninterrupted power supply, internet connectivity, security and confidentiality of the data, long-term financial plan, upgrading at appropriate intervals. So how are the system and processes going to work? When you have got the hub, the primary health care in the center, then you have got 4 arrows indicating e-records, e-care, e-resource, and e-links or e-linkage. E-records. Now I have enumerated what you can put in e-records. You can put link identification number, name, date of birth, date of death, height, weight, address, and if possible, drug immunization details. E-care. Now the emphasis is on prevention. So let's look at the nutritional status our Prime Minister has been talking about, such as BMI record, outbreaks, demographic details, source identification of the outbreaks, school health initiative in a defined population, health education leaflets in local language, immunization programs, clean drinking water and waste disposal initiative. We are talking about IT, we are talking about major things in hospital. What about clean drinking water in the villages? People are not getting even clean drinking water in the villages. For God's sake, let's start some program that can give at least clean drinking water in our villages. And you know many diseases are linked with clean drinking water. Antenatal and postnatal checks and protocols, family planning assessment clinics, and this should be audited and evaluated at 6 monthly interval. Then we have got the proper doctoring, as we say, e-care, curative, symptom-based diagnostic algorithms, prescription details linked to pharmacy, chemist or dispensary locally, follow-up, secondary prevention, and developing local clinical risk management. Nobody has talked about clinical risk management. Iatrogenic diseases, wrong operations, wrong prescriptions. We have to look at clinical risk management. We have to talk about clinical risk management in this country. And there are many issues regarding this. And there should be daily audit at a primary healthcare level and also at DGH level by senior clinical staff. I'll finish in 1 minute. Then we have daily sort of costing, cost of running. We have got finance, needs assessment, allocation of money, budget forecast, funds received, and you can read there, so on and so forth. Many things can come into it. Then you can have e-resources, ID for medical nursing, paramedics, CME available for medical workforce, etc. GP roster. And then there are e-links that can be linked to central database. You have primary healthcare center at the hub, and then you have got DGH, and then you tertiary care center, and then central database. You can go to the community healthcare center, and then you can go to the central database. So what about the, it will allow me not to talk about business a bit. So if you look at the clip that I put up, published in the recent Economist, which I picked up at Heathrow Airport a few months back, it says that the consumer healthcare only less than 20% and I suppose that most of the money goes into buying consumer products like toothpaste and soaps. What about direct investment, like in vaccines, in drugs, in higher-end medical products? China is capturing that market. We have to do better than that. So I come to my last slide, which I'm going to conclude, and I leave you the lines of Rabindranath Tagore, and you can read it. But what I have to say is I'm not going to speak about my website. I'm going to tell you what you all are betraying sitting in this room. You are the elite of this country, and what you should do, you should look at the rural health service, and you should bring people from the private corners in the industry to support the rural healthcare in this country. It is naive to talk that people go and sell their houses and lands, and then you are talking about the elite. The elite is betraying this country. Let me tell you, these are strong words. You may object, but elite is betraying this country, and we must not let that happen. Thank you very much.